Understanding lung cancer, causes, research, and future directions. My purpose of the study and my reasoning for choosing this topic is to understand how lung cancer develops, spreads, and is treated. Lung cancer is important because it is the leading cause of cancer deaths around the world. Cancer affects many, and lung cancer is the most deadly and most common. My research focus is the impact of environmental and genetic factors on the development of lung cancer. What is lung cancer? Lung cancer is uncontrolled growth of abnormal cells in the lungs, referring to tumors originating in lung parenchyma or within the bronchi. There's two types, non-small cell lung cancer and small cell lung cancer. Some major causes include smoking, air pollution, asbestos exposure, and genetic mutations. Smoking is the most common cause of lung cancer, with 90% of lung cancer being due to smoking. Key biological process. Mutation of oncogenes / tumor suppressor genes leading to uncontrolled cell division. Repeated exposure to carcinogens leads to dysplasia of lung epithelium, leading to genetic mutations and affects protein synthesis. I looked at a study, a research study about different patients going through different types of treatments, and it was conducted about patients' preferences for their role in treatment. Japanese patients with advanced non-small cell lung cancer in Okayama University Hospital who underwent chemotherapy participated in this study. Various patients were given various types of treatment and kind of surveyed on it, asked questions, and the main outcomes of the study were three versions of preference. Patients who are younger, female, and more educated tend to become, they're more active throughout treatment and more energetic. Patients' preferences and perception shows relatively high concordance and discrepancies remained between patients and physicians, and despite no specific trend, more patients with lower HADS-AD scores tended to perceive that they play a more active role than those with higher HADS-AD scores. This method was appropriate for studying lung cancer because it gives the patient a say on what type of treatment they're receiving and how different treatments affect different types of patients, and also showing the side effects that certain treatments can have on certain patients. So what I've learned while researching about lung cancer is most deadly. The treatments are difficult, but there are many different types, and they all affect patients differently. There are two types of lung cancer, small cell and non-small cell, and overall lung cancer is uncontrollable cell division in the lungs. What I learned from the study is how different treatments affect different patients. I learned that different types of treatments can cause patients to feel more active and outgoing, while others can make a patient feel depression, anxiety, lower energy. Future impacts and personal impact. Future research investigate personalized medicine for patients with different genetic mutations, and study prevention methods for non-smokers exposed to pollution. Personal impact is I learned how biology connects to a real-world health issue and how the research changed my understanding of cancer treatment.